page 7. They are valuable theoretically because they have taught us that external events determine the pathology of hysteria to an extent far greater than is known and recognized. It is, of course, obvious that in cases of traumatic hysteria, what provokes the symptoms is the accident. The causal connection is equally evident in hysterical attacks when it is possible to gather from the patient's utterances that in each attack he is hallucinating the same event which provoked the first one. The situation is more obscure in the case of other phenomena. Our experiences have shown us, however, that the most various symptoms, which are ostensibly spontaneous and, as one might say, idiopathic products of hysteria, are just as strictly related to precipitating trauma as the phenomena to which we have just alluded, and which exhibit the connection quite clearly. The symptoms which we have been able to trace back to precipitating factors of this sort include neuralgias and anesthesias of very various kinds, many of which had persisted for years, contractures and paralyses, hysterical attacks and epileptic convulsions, which every observer regarded as true epilepsy, petit mal, and disorders in the nature of tic, chronic vomiting, and anorexia. Carried to the pitch of rejection of all nourishment. Various forms of disturbance of vision, constantly recurrent visual hallucinations, etc. The disproportion between the many years' duration of the hysterical symptoms and the single occurrence which provoked it is what we are accustomed invariably to find in traumatic neuroses. Quite frequently, it is some event in childhood that sets up a more or less severe symptom which persists during the years that follow. The connection is often so clear that it is quite evident how it was that the precipitating event produced this particular phenomenon rather than any other. In that case, the symptom has quite obviously been determined by the precipitating cause. We may take as a very commonplace instance a painful emotion arising during a meal but suppressed at the time, and the producing nausea and vomiting which persists for a twilight state and had a terrifying hallucination for months in the form of hysterical vomiting. A girl watching beside a sick bed in a torment of anxiety fell into a twilight state and had a terrifying hallucination, while her right arm, which was hanging over the back of the chair, went to sleep. From this there developed a paresis of the same arm, accompanied by contracture and anesthesia. She tried to pray, but could find no words. At length she succeeded in repeating the children's prayer in English, when subsequently a severe and a highly complicated hysteria developed. She could only speak, write, and understand English, while her native language remained unintelligible to her for 18 months. The mother of a very sick child, which had at last fallen asleep, concentrated her whole willpower on keeping still so as not to waken it. Precisely on account of her intention, she made a clacking noise with her tongue, an instance of hysterical counterwill. This noise was repeated on a subsequent occasion on which she was wished to keep perfectly still, and from it there developed a tic, which, in the form of a clacking with the tongue, occurred over a period of many years whenever she felt excited. A highly intelligent man was present while his brother had an ankylosed hip joint extended under an anesthetic. At the instant at which the joint gave way with the crack, he felt a violent pain in his own hip joint, which persisted for nearly a year. Further instances could be noted.